Hello everyone, this is Dr. Rayaz Ahmed. I'm working as senior consultant in Rajiv Gandhi Cancer Institute, New Delhi. Now, this is, as we know, this month is myeloma month, and I'm here to increase the awareness about multiple myeloma. So the first basic question is, what is multiple myeloma? Multiple myeloma is a type of blood cancer which can affect different part of our body. Now, it arises of increase in plasma cells within the bone marrow. Normally, these plasma cells produces proteins which help us to fight infections. But when these plasma cells get malignant, they produce large amount of proteins which affects different part of the body. Few organs which get specifically damaged by this increased protein are first, it can cause anemia. It can cause low hemoglobin, which is anemia. Patient can present to us with low hemoglobin levels, and he has been taking iron, folic acid, multivitamins, but no avail. And finally, on further evaluation, it turns out to be multiple myeloma. Other organ which can get damaged is bones. So what happens is, these bones get damaged. The patient may complain of having backache. They can have pathological fracture of any part of the body. Once evaluated, they found to have multiple myeloma. When third part of the body is which gets affected is kidneys. So the patient can have damaged kidneys, and they will have the increased creatinine level. And once the symptoms of increased creatinine that can have this loss of appetite, increased vomiting, and decreased urination. With these symptoms patient presents on further evaluation, the nephrologist finally diagnoses to have multiple myeloma before transferring the case to oncologist or hematologist. Finally, the last symptom which can happen is the patient can have severe infections, and on evaluations, the patient can again want to have multiple myeloma. So these were the different scenarios in which a patient can present to us. Also, when the bones get affected, from the bones, the large amount of calcium get released into the blood, which can lead to hypercalcemia, and all features of hypercalcemia like increased thirst, increased urination, dry skin, confusion can be there. So when all these symptoms or either of these symptoms are there, and finally the diagnosis of multiple myeloma is made, the treatment is being offered to the patients. So how do we exactly diagnose multiple myeloma? These were the symptoms, and what are the diagnostic procedures we do to confirm the diagnosis of multiple myeloma. Now, multiple myeloma, generally we cannot have just low hemoglobin and say it's a multiple myeloma. No. So we need to do some specific tests like blood test. We have electrophoresis, we have got serum free light chain assay, we have full panel of kidney function test, liver function test for the staging, beta-2 microglobin. You have to do bone marrow. You have to get bone marrow aspirate, biopsy. You have to send fish panel for prognostication. Based on all these tests, you diagnosed multiple myeloma, in which in the bone marrow, you will see increased number of plasma cells ranging from 20%, 30% to as high as 90-95%. And all these tests, bone marrow aspirate, biopsy, fish panel for myeloma, beta-2 microglobin, when you have staged this multiple myeloma in stage 1, 2, 3, then you can offer the patient different therapies depending on his age, what his clinical condition is, what his comorbidities are. And then when you stage according to them, whether it is a patient is transplant dependent or patient is non-transplant dependent, how the patient is going, what size the financial aspect, a lot of things when you have a discussion, how long you expect this patient to live, and you can start him or doublet or triplet. The preferred regimen is triplet. Triplet means 3-drug regimen. With this, you have to give a specific period of time, then you have to go for consolidation therapy followed by maintenance. These are the three main arms of the treatment of multiple myeloma. Life expectancy, yes, at least 7 to 10 years. It can be not selling only 10 years of life for multiple myeloma. It can be, if cared nicely, it can go up to 15 years of age. In present scenario, if we have drugs which is bound to come in future, which may have major impact on the treatment, that you will have that life expectancy going 15-20 years, hopefully. So initially when the patient gets diagnosed, we give them something called bortezomib-based therapy. You will hear about it, lenalidomide-based therapy, steroids, combination of these three treatment, bone strengthening drugs like zoledronic acid. We give over a period of 3 to 4 months. When the patient's disease is under control, we offer them the transplant eligible. We do the autologous bone marrow transplant. It's not a curative. It's just like a consolidation, means we are making the patient having good quality of life with transplant, followed by maintenance therapy, prolonging his life, making his disease in control, prolonging his remission status as long as possible. Eventually, 3 years, 4 years, 5 years down the line, from patient to patient, it can differ. Eventually, the myeloma relapses. Again, it's a sign of not to worry. It's just the disease on your regular follow-up in either electrophoresis or serum free light chain. It will show that myeloma is recurring. Then what we do is we change the therapy. We offer them other drugs. Again, the same process, give them some triplet therapy, make the disease come under control. And again, the maintenance therapies are like this. You can do 3 to 4 times in current scenario. And you can expect the life expectancy, good quality of life, almost, I can say 7 to 10 years in regular practice. Why not 10 years, 10 to 15 years also. Okay. The longer the patient lives, we expect what we expect for every patient, the finances take a toll. It's not an easy thing. A lot of companies are coming up with generic molecules, the cost being very low, affordable range, but still, apart from chemotherapy, maintenance therapy, daily visits, investigations take quite a toll. The whole idea of awareness is, if it's not like that you have been diagnosed cancer and your life is going to end, it's a low-grade cancer, you can continue the treatment and you can make sure that you are living with the family, having a good quality of life. There are a few major personalities who have been treated and they have lived as long as 15 to 20 years. Now, a lot of questions will be asked regarding how long to be taken, when to take. When you can meet then in whichever country you are and whichever part of the country you are there, just meet the oncologist, listen to him. Opinions you can take from different oncologists, but just stick to one oncologist, hematologist. Follow the procedure. Do not discontinue the treatment. Continue as per the what your oncologist is saying. If you are having any issues like any side effects of the drugs, discuss with him. You can modify, you can change the therapy, you can reduce the doses, you can stop in between, but only after consultation with your doctor. There are patients who have been in India. We generally see all cancers a decade earlier. So generally, this is a myeloma in Western world. It's in the age of 6th or 7th decade, but in India, you can see as early as 4th decade of life. But most of the patients are in 5th and 6th decade of life. That means we have to work a little bit harder than the Western world with the in view of limited finances and the age expectancy and the life expectancy. We want it to be higher than the Western. So it needs a coordination between your doctor and the patient and these attendants who have to bring the patient again and again so that he lives longer and have a good quality of life. Thank you.